Hi, everybody, and welcome to another edition, our July edition of Stay Connected with the Worcester Senior Center. And I'm your host, Dr. Michael Hirsch, Medical Director for the Division of Public Health for the City of Worcester. And wow, this is the edition that marks the second half of the year has started. That's just amazing. It's just flown by. And here we are in the month of July. Amazing. So this is what sun worshipers crave, and this is what the folks that complain all winter about, I wish we lived in Florida and can't afford to. This is what you have to savor, is these summer months. July, I think, is going to be a hot one. As we're recording this towards the end of June, we're sitting in the middle of a time here in Worcester where all of the 911 networks have gone down. So the recommendations are coming out, whether you're getting emergency text messages or emails or other ways of communication, you're being told to call local police numbers, non-emergency numbers, as a way of getting to 911 services. This seems like a kind of an annoyance today, but this is kind of the canary in the coal mine. I think that the energy crisis that is coming with the problems we're having with climate change, I think we're going to have summers with these breakdowns of systems, brownouts, and frankly, blackouts, where we won't have enough cooling to make your air conditioner work. Right now, Worcester is running 4 cooling stations for those that need to find a place to just get out of the heat. And I think that we just have to pay attention to this. We presented about 2-3 months ago. We had a guest professor from University of Miami come and talk to us about the health impacts of climate change. And there are many. And I think you, as the core of the senior center, really have to be advocates for us. I mean, our generation and your generation, we didn't do so great with how we guarded our natural resources and how we allowed fossil fuels to eat up our ozone layer and create these very, very extreme cold and heat conditions that we're experiencing all through the 4 seasons. And I think we have to find at the ballot box, we have to find within city government progressive leadership that understands that, yes, we have to do something about it. We can't just sit back and do the status quo. So to our city manager's credit, Mr. Bautista has established an Office of Sustainability, and we have a Green Worcester plan in place that's going to create a lot of new trees, new health mitigations that will help to make the extremes of climate less impactful. And I'm 100% supportive, and that's what we're also working with the Office of Sustainability at the Department of Public Health to try to make sure that moving forward, we have a plan in place. So you're going to see a lot more about conversions to electric vehicles in Worcester from the city government, and we're hoping that the public will take that into mind too when they're buying a new car, or at least a hybrid version, which saves quite a bit of fossil fuel consumption. So that's kind of the new normal, I think, for summer months is that we're going to be seeing some of the effects of there's not enough electricity to go around to countermand the extremes of temperature that we're going to experience, unfortunately. That being said, July is an awesome month. July, as you might imagine, the seventh month of the Gregorian calendar is named after Julius Caesar. He originally had created a Julian calendar that then got converted over to the Gregorian calendar sometime in the Middle Ages. And July has always been known as kind of the first full month of summer. In the North American hemisphere, it's always technically the hottest month temperature-wise of the year. It's a time for lots of vacations. Generally, school is out. There are some kids that are in summer school, and there are some college classes and programs that are still going on at our medical school. The only time that the students have time off in the summer going to get their MD is the first year, between first and second year. And most of the students now are doing courses during that time. The other years, everybody is working right through until they graduate in the June of their fourth year. So what about July that's special? Well, the gemstone for July is the ruby, very beautiful stone. The official flower for the month of July is the white water lily or the blue delphinium. So it's a nice color combination if you make a bouquet of both. If you're a gardener, this is peak time to see roses blooming and other flowers that you might have planted. And also some of the folks that do their vegetable gardening will start to see the produce from their hard work of planting and watering and all the things you have to do to keep a garden going. I guess the most significant event in July here in the United States is the 4th of July. That's the birthday of our country. And that's when Thomas Jefferson's Declaration of Independence was adopted by the Continental Congress down in Philadelphia. And it officially meant that we were all traitors to the British Empire. And we had better win the War of Independence. Otherwise, as traitors, we could all be hung. Interestingly, historically, Worcester, although it doesn't get a lot of credit for this, Boston gets all the credit for the Tea Party and Bunker Hill and all of those events. Our local militia took over the Worcester Commons outside of City Hall in 1774, a year before all those Boston events happened, and prevented the tax collectors who were trying to, collect these new tariffs that the mad King George III had imposed on the colonists from being collected. And they succeeded. And we really were the start of the revolution here in the Wu. Though we don't get much credit for it, except for real history nerds like me, there was a lot of revolutionary fervor here in Worcester. And we were one of the real cradles of liberty back then. So 4th of July, we celebrate that amazing move to throw off the yoke of colonialism. And it's just amazing. I mean, Britain was the biggest superpower in the world at that time. And it took us 5 years, but from 1776 to 1781, George Washington led our Continental Army in many battles. Some we won, some we didn't win. But once Marquis de Lafayette from France joined us in 1777, we started turning the tide. And by 1781, with the defeat of General Cornwallis in Yorktown, Virginia, we were able to defeat this much more powerful army. I guess our former city manager, Ed Augustus, used to say, Worcester always punches up in weight class. And that's what we did as a country of those 13 colonies that decided to rebel together. So for whatever you do on 4th of July, whether it's a barbecue, picnic, take a minute to explain to your children, your grandchildren, what it really means. It's not just about hot dogs and, firecrackers and, parties, but it's also, I think, a pretty important moment in our country's history that we established that it was more important to be free of unreal and unreasonable colonization than suffer the consequences of being under the thrall of the British Empire. And we took a chance, a big chance, and we won. So what else is going on in July? July 1st is actually Canada Day, our neighbors to the north. And in my family, we always acknowledge that because it was the Canadian Army that liberated my parents from concentration camp in Holland. They landed on Juno Beach at Normandy. We just last month celebrated the 80th anniversary of D-Day. The Canadians that landed there ended up making their way across Europe, and they took a left turn. And in 1945, after the terrible winter, they liberated one by one the various towns and encampments and concentration camps that were throughout the Netherlands. So my folks were always very grateful to the Canadians. And my mom actually served in the Canadian Army after she was liberated for 1 year as a nurse. So Canada Day, July 1. The July month is recognized for two of my favorite things. It's National Hot Dog Month, and it's also National Ice Cream Month. Oh boy, those two things alone make for a party for me. I'm a huge hot dog fan. And I know that the nutritionists who might be in the audience know that some of the hot dogs have too many nitrites and preservatives, but you can get them now uncured, and you can get them in a more natural casing. They are really delicious, and I'm an unapologetic hot dog lover. And we're very fortunate with our wonderful institution of Coney Island here in Worcester, which I think serves some really good hot dogs at a ridiculously low price compared to other places that you can go get them. What else do we recognize in the month of July? The fourth Sunday of July is called National Parents' Day. And those of you who are seniors, many of you are parents yourselves, and many of you have children who are parents. And I'm going through that phase now. Both of my adult children have become parents in the last year, which means I'm a grandpa for the first time. And, tribute to their mom, both of my adult children are wonderful parents and have married spouses that are wonderful parents. And it's a joy to behold how their little children are turning out. One just turned 1, and the other one is 6 months older than that. And they are fast little cousin friends, and it's just a beautiful thing. Parenting is very difficult. I can't speak to me being an expert in it myself, because as I was coming up the ladder as a pediatric surgical trainee and then eventually as an attending in pediatric surgery, I was an absentee quite a bit. And it really was my wife that was able to hold a family together, keep me on track, tell me where I should possibly be. Sometimes I couldn't be, and she made up wonderful excuses when I couldn't be. So the kids have grown up still to like me, or at least that's what they tell me. But I have tremendous respect for parenting. And, you know, when I was practicing pediatric surgery, I was operating on children, but you had to actually deal more with the parents than the child, because they're the ones that are protecting the child. They're the ones making the decision for the child. And some of the children that I dealt with had many, many medical problems that you're just amazed how people can compensate, accommodate, navigate life with a child that has disabilities or congenital problems. So I have a tremendous amount of respect for parents, and although National Parent Day is pretty obscure, I mean, you're not seeing a lot of advertising about it, I would salute all the parents out there for whatever they've done to raise a family and hopefully keep that family moving together in the right direction and staying together for the important holidays during the year and life events, births, fortunately deaths, marriages, weddings, graduations, whatever. Hats off to you. And then on the 27th of July is the Korean Armistice Day. And, now, just as we're seeing fewer and fewer of the World War II vets that are still alive, I don't know how many of you watched any of the ceremonies from Normandy on June 6th of this year. All of those folks are in their, late 90s, even early hundreds. And the Korean War vets are only about a decade behind, not even. It's hard to imagine that when World War II ended in 1945, that by 1950 we were back at war in Asia, fighting the North Koreans and the Communist Chinese. So a lot of our Korean vets are getting up there in age, and they deserve a tremendous amount of credit, because as much as Korea is known as the forgotten war, it did some very important things. It really did stem the tide of the communist advance in Asia. It kind of set the tone for what the United Nations could be, because the force that was fighting in the defense of the South Korean Republic was a multinational force headed up by the United Nations. It wasn't a United States effort. And unfortunately, I don't think the UN has worked as well since then. But for that particular era, it really established the hope, I think, that nations could cooperate to fight injustice. We're starting to see a little bit of that now, again, with how NATO is firmly defending the Ukraine against the aggression of Vladimir Putin. So maybe there's going to be a little revival of this kind of multinational collaboration, but it was certainly on display in Korea, and fighting there ended up in a stalemate along the 38th parallel, but that was a big victory because numerically the Chinese army outnumbered us by hundreds of thousands of men, and we were able to fight them to a standstill. So hats off to the Korean vets. If you're listening, I salute you, and I hope that you take a moment to just understand how you saved the United States the same way as the World War II vets were celebrated for their D-Day performances. So that's kind of what I can tell you about July, and now I have to segue, as I always do, to our public health news, as such as it is. I'll say first off that as you're going to be listening to this, I think that the Worcester Vision Zero collaborative, which was established by our city manager, Batista, to try to reduce pedestrian fatalities here in Worcester. We had 82 since 2019, which is a lot. And a lot of what went wrong with our city roadway design was that in trying to relieve traffic congestion, we failed to recognize that this was going to make it much more dangerous for pedestrians and cyclists in our town. If you couple that with the fact that everybody is distracted as they're driving, it seems. There are a lot of people texting in their cars. There's people texting as they're walking in the street. People are not paying attention to the job at hand, which is to get from point A to point B safely. So we're hoping that this Vision Zero task force, which I've been a part of, will have come up with some important recommendations as to how we can shore up the safety factors around the hot spots that they identified around Worcester, so that we can make the roads safer. As far as the infectious disease kind of update I can give you, we are seeing an uptick in COVID. The Omicron variant group is called KP.1, and it's also been called, and I don't understand how this mnemonic got out there, the FLIRT variant, F-L-I-R-T. Like the other variants we've seen before, the outer capsule is very different from the original iteration of COVID virus, and so it's more transmissible, but it doesn't seem to pack the same level of punch that the previous variants have done. So we're not seeing the hospitals getting huge numbers of admissions. We're not seeing the emergency rooms filled with patients with respiratory distress, but we are seeing employees of various institutions, whether it's nursing homes, hospitals, places of business, go out sick thinking they have either a summer cold or maybe a little touch of allergies, but when they actually test themselves, they're testing positive for COVID. So that can make staffing a problem in hospital settings, certainly, and also if you're running a restaurant or something like that. So the advice that the CDC is giving is that don't assume that a sniffles is allergy related or related to some summer cold. Get yourself tested, and that's not as easy as it was during the height of the pandemic because we don't have testing stations and we don't have free tests anymore. You have to go out and get them. And if you test positive, you're supposed to stay home at least for 24 hours after you were last symptomatic. And then you have to wear a mask for a total of 5 days from the time you became symptomatic. If you go outside or go back to work, you should wear a mask until that 5-day period is over. You don't have to retest to go back. If you are a high-risk patient, though, and we've talked about these risks before, if you're obese, you have any kind of autoimmune disease like lupus or rheumatoid arthritis or HIV, if you have cardiac or respiratory problems, if you're diabetic, and if you're over 60, you should at least talk to your primary care physician about getting Paxlovid. Paxlovid medication can reduce the intensity of the symptoms if you get COVID, and it can help to keep you out of the hospital. The other thing that's available is a monovalent vaccination against COVID that came out last September. Not many people took advantage of it. Less than 30% of the population got that vaccination. And then the CDC asked that it be repeated in the spring, in April, if you were one of those high-risk people. So there are a lot of people that are kind of no longer up to date with their vaccinations, and getting up to date with the vaccinations may be the way we have to push the community if we really do see a big change in the number of hospitalizations, which we so far haven't. In the fall, we're told that they're developing a specific vaccination against this group of flirt variants. And they may be combining that with the flu vaccine. So that may be the things we talk about in the September show that we do. But so far, it hasn't been formally announced. But that's what we've been hearing in CDC updates that they've been giving the Department of Public Health. Unfortunately, just recently, they just found a number of vaccine-resistant influenza germs that are out there. They haven't been seen widely, but they are out there, and the possibility is that the flu vaccine will not work against them, and they may become the dominant strain. If that's the case, the virologists and the folks that make the vaccines are going to have to get hard to work to figure out a way to give a vaccine that's clearly fighting that new resistant type of flu. And our former CDC chairman, Dr. Redfield, came out in June with a prediction that the avian flu, the bird flu, is going to be at pandemic level at some point. That to me was not a useful prediction. That's like saying, someday there'll be another eclipse. Yeah, they will, but when? It's can't be on high alert the whole time waiting for that to happen. The avian flu, which is H1N5, has only been seen now in 4 people in the United States, and all 4 of them caught it from an affected cow. and how did the cows get bird flu? They're being fed food from chickens, and the chickens are giving them the bird flu. That's being very carefully monitored by the Department of Agriculture and the CDC. So far, there has not been any transmission between a human and a human getting bird flu. There have been populations of rodents that have acquired the bird flu, probably again because some of them, like weasels and ferrets, they hunt for birds, and the birds may be carrying this stuff. But so far, there hasn't been enough there to put anybody on high alert that bird flu is something that you need to really spend a lot of time worrying about. I think the more important viral stuff that we have to worry about is the mosquito and tick-borne illnesses that we're expecting to be more common this summer. So there was a very wet but not very cold winter. Same thing with the spring, very wet. And all of those conditions make for a lot of mosquito propagation. The larvae live in the swampy stuff and stagnant water. And that makes it more likely that we're going to see more mosquitoes this summer. And the mosquitoes, as you know, they carry two main diseases that we're concerned about. One is West Nile virus, which is not really generally fatal or even severe to humans unless you have an underlying medical condition and you're in a weakened state. You will potentially suffer from virus-like symptoms, headache. Maybe you don't like to be in the bright lights. Maybe you have a little, nausea and indigestion kind of stuff. But it generally runs its course in 72 hours. The one that we're more worried about is EEE, Eastern Equine Encephalitis. That one is less commonly seen than West Nile, but it's much more deadly, and it can cause severe infection in the lining of the brain that can lead to coma and death. It is something that we associate with horses because mosquitoes will bite the horses too and cause illness in the horses as well. So we are monitoring that really carefully with the Central Mass Regional Mosquito Control Commission. They have their test baskets all over Worcester. If they find mosquitoes that are carrying these viruses, they will initiate a spraying program, and they'll give plenty of notice about when and where they're going to spray. And during those hours that they are spraying, they're going to just ask you to keep your kids inside, your pets inside, keep your windows closed, and make sure that you're not out and about, doing athletic or strenuous activity, because you'll suck in the pesticide that they use. I think that the other one that seems to be concerning is the tick-borne illnesses. So you know that the deer tick carries not infrequently Lyme's disease, and Lyme's disease can cause a lot of chronic fatigue, achiness, intermittent fevers. It can be hard to diagnose because it doesn't necessarily knock you out, but it just makes you feel bad. But there's a new one that seems to be coming up the chain, which is called babesiosis. And the babesiosis is a little different virus than what's in Lyme's disease. And we're hoping that it doesn't really take off, but it's been found now in a number of deer ticks, particularly on the Cape and the islands. So Worcester itself is not that much as endemic a place as those places. They seem to like the shoreline or the sea air. Being landlocked helps us a little bit. But it's important that if you're doing any kind of outdoor gardening, outdoor work, if you're out in the woods hiking, check yourself for ticks when you come back in, and check your pets for ticks when you come back in the house. You can get a special set of forceps, little tweezers that will help to remove them. There's information on our www.worcesterma.gov/health site that will show you the best way to try to remove them, because you want to try to remove them whole without leaving any tick remnants, parts still attached to your body. If you do get a tick bite and you get the tick off, you can just monitor the area, but if you start seeing kind of what we call a target sign, a pale area around the bite then surrounded by a red spot, you should talk to your primary care physician about getting a couple of doses of doxycycline or ciprofloxacin to knock it out. You only need like 2 days worth of that medication. That will help keep that bite from becoming something blood-borne. And these are the things that we didn't have to worry about when you were a kid. When I was a kid, we didn't think about this stuff. But it's again, another one of the consequences of hotter weather, less cold weather in the winter. You know, this is a climate change consequence. And our guest lecturer, Dr. Judy Schechter, who came to the Board of Health, made it very clear that this is all part of a very large impact that climate change will have on all of us. Climate change also affects your blood pressure, your sugar levels, your heart contractility. So all of these things are stuff that we didn't have to deal with perhaps before, that we're going to have to monitor carefully. And hopefully, as I mentioned, we're going to start to stem the tide of some of these consequences by getting to the root cause of where's all this extra heat, or at least extremes of weather conditions coming from. So those are the public health kind of alerts that I can give you. We have our standard warnings about if you're swimming in any of our lakes or ponds or pools. Hopefully you're going to places that have lifeguards, but if you don't have lifeguards, and even if you do have lifeguards, don't assume that your kids are safe swimming or your grandkids are safe swimming. It's great to supervise and keep an eye on them. It only takes a couple of minutes of inattention and suddenly a child goes missing and they find them on the bottom of the body of water that they're in. If you can possibly get your family to learn how to swim, and I say family because if a little kid has parents that don't know how to swim, they're probably not going to ever learn how to swim. But if you can get everybody in the family to learn how to swim, it makes all of those water activities a lot safer. If you are going to be in any kind of a boating vessel, including one of these ski-doos or those kind of things, wear a life preserver. Wear a life preserver in a boat, wear a life preserver on those ski-doos, because again, if you got thrown out and knocked unconscious, you will at least float with one of these devices on. It'll make it easier for you to not drown and also to be found quickly. Basic stuff about fun in the sun. Sunscreen, very important. Most of the sunscreens now are made to last so that you don't have to reapply them every time you get sweaty or every time you go in the water. It should be an SPF level of at least 30. Once you get past 50, it's probably, not any more protective. But also, think about wearing hats with visors, sunglasses, because the sun's rays can cause damage to your retina, and also eventually can even develop the skin changes that we're most worried about. Melanoma can go in your eyes too. So polarized sunglasses are a very wise thing to wear in the very, very sunny weather. You have to pay for your fun, pay for the warm weather fun with these preventive things. And, for the mosquito piece, I probably have said this to you in 4 or 5 shows already in the last year. The 5 Ds of mosquito bite prevention. Don't go out in dawn or dusk. That's 2 of them. When you go out, if you possibly can, if it's not boiling hot, dress appropriately with longer sleeves and longer pants. If you're wearing socks, put the socks over your pants, because that will keep the ticks from getting in under your skin. And then wear DEET, which is the insect repellent that's very safe and very effective against mosquitoes. And if you do have in your possession, if you're in a single family or triple decker home, you have a bird bath, you have some old tin garbage can tops that are retaining water, old tires, all of these areas where stagnant water can accumulate, make sure you empty them out. Or you have a neighbor that's too old to do that, offer to help them empty it out so that the mosquitoes don't have a nice place to reproduce right next to your house. Those are the 5 Ds, and that can reduce greatly the likelihood that you're going to get bitten. I don't think I have much more to tell you about July. I hope that you still enjoy July. Enjoy ice cream on National Ice Cream Month and hot dogs on National Hot Dog Month. And if you do get a hot dog, think of Dr. Hirsch. I love hot dogs. That's all I can tell you. Baseball, hot dogs, and ice cream, that's my jam. Thanks for listening. We'll see you again next month, and be well out there.